afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dorothy Shephard, Minister of Health. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont la médecin hygiéniste en chef, la Dr. Jennifer Russell, et l'Honorable Dorothy Shephard, Ministre de la Santé. Dr. Russell.
Merci, Bruce. Thank you, Bruce. I think I missed the memo on wardrobe attire today. You're a Habs fan. Bon après-midi à toutes et à tous. Good afternoon, everyone. À chaque stade de notre lutte contre la pandémie, je suis venue à ces conférences de presse pour offrir un message d'espoir. Au cours des 16 derniers mois, plus de 2300 personnes au Nouveau-Brunswick ont contracté la COVID-19. Des centaines de personnes sont tombées gravement malades. Plus de 130 ont dû être hospitalisées. Malheureusement, 46 de nos concitoyens sont décédés à cause du virus. Through it all, we have sought to keep hope alive, even when the news has been discouraging, because hope is a powerful force. With hope of improving conditions, we can all keep going. We can continue to make sacrifices. We can look after ourselves and our families because we know what we are striving for. We can shun despair and embrace optimism. But now it seems our roles have been reversed, and now it is you who are giving me hope. And I want to thank you for that from the bottom of my heart. Avec chaque semaine qui passe, nous nous rapprochons de notre objectif, soit de pleinement vacciner au moins 75% des Néo-Brunswickois. Plus de 43,5% de la population a maintenant été pleinement vaccinée et presque 79% a reçu au moins une dose d'un vaccin contre la COVID-19. With each passing week, we draw closer to our objective of having at least 75% of New Brunswickers fully vaccinated. You are making this happen. Now, we have 43.5% of our eligible population fully vaccinated, and nearly 79% have received at least one dose of the COVID-19 vaccine. Every day, thousands of New Brunswickers are rolling up their sleeves to move us closer to this goal. Yesterday, 14,783 New Brunswickers were vaccinated. We are making tremendous progress. And I am more optimistic than ever that our objective can and will be achieved. I'm confident that we will soon reach the point where COVID-19 can be managed without the restrictions currently in place with respect to public health measures and public movement that we have all lived with since March 2020. Your actions are giving hope to everyone because as more New Brunswickers become fully vaccinated, fewer New Brunswickers are becoming seriously ill due to COVID-19. And the numbers speak for themselves. Durant le mois de juin, Santé publique a confirmé 121 cas de COVID-19 au Nouveau-Brunswick. 5 de ces cas seulement sont survenus chez des personnes qui avaient été pleinement vaccinées. During the month of June, Public Health confirmed 121 cases of COVID-19 in New Brunswick. Just 5 of those cases were in people who were fully vaccinated. And in the past month, no New Brunswicker who has been fully vaccinated was admitted to hospital due to COVID-19. And during the month of June, no fully vaccinated New Brunswicker died due to COVID-19. Vaccines are making a difference. By becoming vaccinated, you are making a difference. And while we continue to see new cases, we expect that fewer of these will lead to serious illness, hospitalization, and death. Hope is growing with each passing day. Please get vaccinated as soon as you can and gently encourage your family, friends, neighbors, community members, colleagues to do the same. Vaccination is the surest and straightest path to a new normal. Aujourd'hui, Santé publique ne signale aucun nouveau cas de COVID-19 dans la province. C'est le 4e jour ce mois-ci qu'aucun nouveau cas n'a été confirmé. Il y a maintenant 10 cas actifs de COVID-19 dans la province. C'est le plus faible nombre de cas actifs que nous ayons vus depuis octobre dernier. Today, Public Health reports no new cases of COVID-19 in New Brunswick. This is the fourth day this month that no new cases have been confirmed. There are now 10 active cases of COVID-19 in the province, and this is the lowest number of active cases we have seen since last October. 2 New Brunswickers are currently in the hospital due to the virus, neither of whom is currently under intensive care. And while we have fewer cases, the impact of the virus on those who have become infected and their loved ones remains life-changing. I ask again that you direct your thoughts and prayers to your fellow New Brunswickers who are dealing with COVID-19. We are seeing this improvement in our situation because more of us are becoming vaccinated. If we all get fully vaccinated as soon as we can, there is hope that this trend will continue. Nous voulons que le processus de vaccination soit aussi simple que possible. Voilà pourquoi le ministère de la Santé et Ambulance Nouveau-Brunswick travaille avec les entreprises et les organisations locales pour offrir une série de cliniques de vaccination mobiles dans les communautés de la province. We want the process of getting vaccinated to be as simple as it can be, especially as we enter the heart of the month of July. That is why the Department of Health and Extramural and Ambulance New Brunswick are working with businesses and local organizations to offer a series of mobile vaccination clinics in communities across the province. These will be walk-in clinics, and you don't need to book an appointment. Just show up with your Medicare card and your signed consent form. If you are vaccinating in New Brunswick this month and you have not received your first or second dose, please keep an eye out for these mobile walk-in clinics. Also, walk-ins are available on a first-come, first-served basis at any of the established clinic locations across New Brunswick. Another mobile clinic is being held today in Paquetteville at the Centre des Loisirs until 4 p.m. The first such clinic was held yesterday in Grand'Anse, where more than 119 doses were administered. Tomorrow, there will be clinics in St. Andrews at the Town Hall parking lot from 8:30 a.m. to 1 p.m. and Bathurst at the Bolorama from 10 a.m. to 4 p.m. There will be a clinic at the Fundy Arena in Blacks Harbour on Friday from 9:30 a.m. to 4 p.m. On Saturday, a vaccination clinic will be held in Dieppe at the Bolorama between 11 a.m. and 6 p.m. These clinics will be providing the Moderna vaccine. If you had the Pfizer product as your first shot, that's not a problem. So these messenger RNA products, Moderna and Pfizer, are completely interchangeable for individuals 18 years of age and older. They work in the same way and are equally effective against COVID-19 separately or in combination with one another. If you had a Pfizer vaccine as your first shot, you can take Moderna as your second and vice versa. So I advise you to take whichever of these vaccines is most immediately available. N'attendez pas de vous faire vacciner juste pour obtenir le même vaccin que la première fois. Ce qui compte le plus, c'est que toute personne qui peut se faire pleinement vacciner le fasse aussi vite que possible. Please don't put off being vaccinated just to match your first and second dose in terms of the products. The most important thing for everyone right now is to get fully vaccinated as quickly as they can. And that is what will give us hope and what will keep us hopeful as we continue our drive to 75. Please don't stop now. We need to keep going. The finish line is in sight. Thank you very much.
Good afternoon, bonjour. I want to begin today by thanking the many New Brunswickers who continue to get vaccinated, as well as those who have booked an appointment to get vaccinated in the days and weeks ahead. By taking this step, you are protecting yourself, your loved ones, and our province. If you haven't had the chance to book your second dose appointment yet, now is the time to do so. We have lots of availability and no shortages of vaccine. You can now book an appointment through Horizon and Vitalite Health Network clinics by visiting www.gnb.ca/bookavaccine or by contacting a participating pharmacy. It is exciting to be able to report that as of today, 43.5% of eligible New Brunswickers have received both doses of COVID-19 vaccine and are now fully vaccinated. I'm also pleased to tell you that the percentage of New Brunswickers aged 12 and older with their first dose is continuing to rise at 78.7%. They've now received at least one dose. If you have not received your first dose, it is not too late to do so. We are continuing to book appointments for first doses, and I encourage you to schedule yours today. Thanks to all of you, we are making impressive progress in our vaccination plan. And because of that, every day we are getting closer to loosening even more restrictions and moving forward on our path to green. Now that we are in phase 2 on the path to green, we are able to welcome our family and friends from other provinces with vaccination and isolation guidelines still in place, and we can plan trips of our own outside of New Brunswick. Many New Brunswickers are taking advantage of these opportunities and enjoying some very well-deserved vacations. For those who are choosing to vacation within our province, the Explore NB Travel Incentive Program provides a 20% rebate on eligible expenses of up to $1,000 that are made while making an overnight stay in New Brunswick. Travel can take place between May 27 and October 31st, and applications are now open and will remain open until November the 30th. More information about this can be found online at www.gnb.ca under the Department of Tourism, Heritage and Culture. And while I encourage everyone to enjoy the new freedoms that come with being at phase 2 on our path to green, please do so safely. For now, the mandatory order is still in place and certain rules apply. We need to continue to wear our masks in indoor public spaces and physically distance from others. We need to do everything we can to keep one another healthy and safe. One way we are doing this is by partnering with employers across the province on a rapid testing initiative. New Brunswick's workplace COVID-19 point-of-care testing program provides organizations with workplace rapid testing. This program helps to give peace of mind to both employer and employees as more people return to the workplace. Small and medium-sized employers who wish to participate can reach out to the closest Chamber of Commerce to apply. You don't need to be a Chamber member to participate. All businesses are welcome to take part in this program. For more information, contact any of the 4 participating Chambers of Commerce, Fredericton, St. John, Moncton, and Edmundston. Information is also available online at www.gnb.ca on the coronavirus webpage under Testing and Tracing. The Chamber program is an extension of a program we launched at the end of March with larger employers. If our vaccination rates continue to rise at the current rate, it is very likely that we will be able to move to phase 3 by New Brunswick Day on August the 2nd. Regardless of what that date is when we get there, once we reach 75% of eligible New Brunswickers vaccinated with 2 doses of a COVID-19 vaccine, we will lift the mandatory order and remove all restrictions, including the requirement to wear masks. Once the mandatory order is lifted, government will no longer be enforcing the current rules and restrictions. It will be up to businesses whether they return immediately to pre-pandemic operations or if they prefer to do so gradually. The same is true of individuals. Some people may embrace an immediate return to normal, while others will be more comfortable with a different pace. It's important that we move forward on our path to green, that we all keep residents healthy and safe, including long-term care residents. Social Development and Public Health are currently developing guidelines and recommendations for long-term care facilities for when our province reaches green. In order to continue protecting New Brunswick's most vulnerable residents in long-term care homes, green will go into effect 2 weeks after the lifting of the mandatory order in the province. We've made impressive progress, but we're not quite there yet. To reach green, we need all New Brunswickers to do their part. Book your vaccine appointment if you haven't done so yet, and encourage other people in your life to get vaccinated with both doses as well. Getting fully vaccinated is the only way to ensure we are protecting ourselves and our loved ones. I believe we will reach our next target by doing what we have done in this province since this pandemic began, by working together to keep one another healthy and safe. And that is how we will reach 75% of eligible New Brunswickers fully vaccinated. That is how we will reach the final phase on our path to green. Thank you again for all you have done to get us to this point. be proud of what we have achieved as individuals and as a province, and keep up this great work. Before I finish, I want to take an opportunity to update the province on the investigation into the cluster of a potential neurological syndrome of unknown cause. I want to assure everyone that the investigation continues as quickly as possible, and public health nurses, clinicians, researchers, and epidemiologists are working hard. As of today, there have been 23 completed interviews using the enhanced epidemiological survey, up from 16 completed interviews last week, and several more have been scheduled over these next few weeks in keeping with our timeline. At this time, there is little additional information to share. The Oversight Committee will be reviewing the data from the enhanced epidemiological survey along with the other case information. This review process is a detailed one, and we knew it would require a few months before the work of the committee would be completed. The Oversight Committee's work will also help determine whether there are any common links between cases, the potential for other diagnosis, and whether there can be treatments offered for some cases. I want to thank all the individuals currently part of this cluster and their families, as well as all New Brunswickers for their patience and trust. In keeping with transparency, the Oversight Committee is working closely with Public Health NB to ensure relevant combined information on the potential cluster of a neurological syndrome of unknown cause is shared with the public in a timely manner, and I remain committed to sharing any new information publicly too. Thank you very much. Merci.
Merci beaucoup. Thank you, Minister and Dr. Russell. We'll now proceed with questions from members of the media. Each reporter will have 2 questions. You have the right to pose your questions in the official language of your choice. Please ensure your microphones are placed on mute. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste aura 2 questions. Voulez-vous assurer de désactiver le son de vos micros? And before we start, I think Dr. Russell has a comment.
Yes, thank you, Bruce. We're so caught up in vaccination. I misread my note about, I said if you are vaccinating in New Brunswick, but I was really supposed to say if you are vacationing in New Brunswick, but I think it's the same thing. No, seriously, so if you are vacationing in New Brunswick this month and you haven't received a first or second dose, please keep an eye out for the mobile clinics.
Thank you, Doctor. Tom Bateman, Brunswick News.
Hi there, can you all hear me?
Perfectly.
Great. Dr. Russell, I noticed yesterday that a large grocery store in my area had removed its directional arrows from the aisles, those stickers we've been getting used to. I figured these kinds of changes would not have happened until we hit the proper green phase. Does this reflect a change in advice from your team to businesses?
That wouldn't be direction from public health at this time. We certainly are working with our partners with respect to WorkSafe and businesses, et cetera, and we will be providing guidance on that, but we can look into that particular situation if you wanted to send that information along to me.
Mr. Bateman,
Oh.
Second question.
Yeah, sure. I guess, like, when would things like that be contemplated by health experts?
Again, we are working right now with WorkSafe and other partners to finalize that guidance on that path to green in that particular sense.
Okay, thank you.
Silas Brown, Global TV.
Hi there, just checking that you can all hear me.
Crystal.
Wonderful. Looking at the rate of first dose vaccinations, that's been stalled between 78 and 79% for a week here. Is that becoming an increasing concern, just the extremely slow pace at which that is moving upwards? And what else will be done to try and combat that? I assume the mobile vaccination clinics are definitely part of that effort.
Hi, Silas. You're correct. The mobile clinics are definitely part of our plan to address those people that still need their first dose, or people who require their second dose who are having trouble navigating the system, what have you. So we are trying to increase accessibility. You're completely right. We would love to see those numbers be as high as possible. Certainly, getting everybody vaccinated with 2 doses at this time at a rate of about 75%. That's, again, one of our key goals at the moment, but also increasing those first doses. My understanding is that several clinics yesterday, several of the mobile clinics actually did provide some first doses to people. I think 119 in total in Grand Anse were first doses. So that's encouraging. We still want to attract those people in terms of being able to provide that access. So the mobile clinics are hopefully going to be able to accomplish that.
Mr. Brown, do you have a second question?
Yes. Speaking about people vacationing in New Brunswick, I'm curious about the numbers that we've been seeing thus far in terms of people coming into the province. It's been a little bit now. Are those starting to steadily tick upwards? Are we seeing, increasing amounts of people visiting New Brunswick from other parts of the country?
I'll take that, Silas. I think I can only speak anecdotally because I've certainly seen a number of varied license plates in my own community, and so we can certainly, certainly understand that we are going to be seeing a lot more. Public safety is really our go-to to have those numbers, and so we can get those numbers confirmed for you, but I would need to have their input.
Vicki Hogarth, CHCO TV.
Thank you, Bruce. Dr. Russell, when will people who were vaccinated in December 2020 and January 2021 require a booster shot? And do new variants like the Delta Plus make the idea of booster shots a more pressing concern?
Great question, Vicki. We are working with our colleagues across the country and Public Health Agency of Canada right now to look at that information. And there is new data and research coming out all the time about how long the immunity lasts. And certainly there have been already some trials done with different types of boosters, including the current type of vaccine that we're giving out right now, as well as some that include the new strains. So again, we'll have more information on that as it becomes clearer in terms of what that path should be for boosters. But at this time, we're just continuing with our approach right now with getting our first and second doses into people right now. But certainly you're right, with variants of concern emerging around the world and variants of interest like the new one that was identified out of Peru, the Lambda variant, it is quite important to keep that at the forefront of our minds as we move forward.
Ms. Hogarth, do you have a follow-up?
Yes. When positive cases are announced going forward, are you considering also listing the vaccination status of the case along with the health zone?
Well, Vicki, throughout the pandemic, we've always been trying to make sure that we respect confidentiality. So I think we'll take that into consideration right now, but I can't make a commitment on that.
Thanks.
Thank you, Ms. Hogarth. Callum Smith.
Thanks, Bruce. My question is for Dr. Russell. I know studies are underway to determine safety, but I'm wondering if there's any updated timeline for when vaccines could be approved for youth under 12, and how concerned you are about the idea of removing all COVID restrictions with that population, at least currently ineligible.
So again, we meet regularly with our colleagues across the country, as well as Public Health Agency of Canada, and we get recommendations from Health Canada and NACI. So we are waiting for that approval to happen, and that timeline is not clear. But certainly, when we do get that approval, we will be able to start vaccinating that population. Certainly, with respect to the risks, we will continue to monitor those risks, and in terms of our de-escalation planning, it does include, our approach to declaring outbreaks, our approach to risk stratifying, close contacts, et cetera, and what the isolation requirements will be. So that work is ongoing, and it will definitely play a role in our approach to going back to school in the fall.
Mr. Smith, do you have a follow-up or a second question?
I do. Thanks, Bruce. And I've asked the department for the percentage of cases in youth under 12, but I'm wondering, Dr. Russell, what you'd say about the impacts of COVID-19 on that demographic and how common is it for spreading in that age?
Well, any unvaccinated part of our population is at a higher risk of contracting COVID. We do know that the younger people are, the less of a risk there is with serious outcomes. However, the risk is not zero. So that's why we are really concerned about getting most of our population vaccinated with 2 doses who are eligible. I think if we cover our bases there, then while we wait for younger populations to be able to be vaccinated, then and that will offer a certain amount of protection.
Thank you both. Justin Dupuis, l'Acadie Nouvelle. Justin? On ne peut pas t'attendre, Justin.
Des hypothèses, pourquoi...
Justin, peux-tu recommencer puis plus fort, s'il vous plaît?
OK, oui, pardon. Est-ce que vous m'entendez mieux?
Oui.
OK. En fait, on parle beaucoup de comment la campagne de vaccination progresse bien chez la population générale, mais lorsqu'on regarde les chiffres chez la tranche de population de moins de 40 ans, les pourcentages de vaccination sont un peu moins élevés tant pour la première dose que pour la deuxième. Donc, je voulais savoir si vous aviez des idées ou des hypothèses pourquoi les taux sont moins élevés chez ces groupes d'âge-là et si ça vous inquiète.
Allô, Justin.
Bonjour.
Alors, on a pris des informations sur cette population récemment pour essayer de comprendre pourquoi que les taux de vaccination seraient un peu plus baissés avec certaines populations, certaines portions de la population. Et une des choses qu'on sait que c'est important de offrir les rendez-vous des vaccins sans rendez-vous. Alors, c'est pour ça qu'on a des cliniques tout alentour du province à ce moment-ci pour offrir les gens soit leur première ou deuxième dose sans rendez-vous. Parce que avoir l'accessibilité et des différents temps, parce que les gens sont occupés, des fois c'est difficile à prendre du temps pour se faire vacciner. Alors, on aimerait maintenant de le faire le plus facile, de le faciliter le plus que possible.
As-tu un suivi?
Oui, en fait, je me demandais juste, donc les cliniques sans rendez-vous font partie d'une manière d'aller rejoindre ces populations-là, mais est-ce que vous avez d'autres idées sur des nouvelles stratégies pour les rejoindre davantage, puis encourager la vaccination autre que les cliniques sans rendez-vous?
Oui, on travaille avec nos partenaires dans le département de communication, puis eux, ils ont beaucoup d'informations qu'ils mettent sur les médias sociaux aussi. Alors, ça, c'est une autre manière qu'on essaie de rejoindre les gens qui ne sont pas fait vacciner encore. Mais encore plus dans nos messages, on veut encourager les gens qui sont déjà fait vacciner, d'aider ceux qui n'ont pas été vaccinés encore, soit avec le transport, soit avec faire des rendez-vous, etc. Alors, c'est vraiment la communauté, la collectivité du Nouveau-Brunswick qu'on aimerait qui nous aide avec ça aussi.
OK, merci.
Merci, Justin. Michelle Cody. Oh, we're going to go to the minister before we go to Michelle.
I'm just going to add to that we want, as we continue encouraging, through our own resources, whether it be social media, newspaper, these news pressers, is that, families have a big influence on each other. And so I'm not in any way encouraging, harassment, but I'm saying is that people can talk to their family members, talk to their friends, encourage them. My husband is petrified of needles. And yet, and my brother as well. And so it took some encouragement to get them to get to that clinic. And sometimes it's not about vaccine hesitancy. It's about little nuances that maybe we don't know, but family members do. And so encourage your family, encourage your friends, help them get to the clinics. And we can only continue to encourage every New Brunswicker because we see the effect it's having. 10 active cases in our province today. No cases today. The testing numbers are really good. So we're getting the results that we want, and we just need to keep giving that message over and over again to encourage and encourage in a healthy way. I also want to just clarify that during my speech, I talked about going green 2 weeks after we hit 75%. And what I was referring to was our long-term care facilities. They will go green 2 weeks after we reach our targets, but the rest of the province will be green. It is really just for our long-term care to give them time to de-escalate their situations.
Perfect, thank you. Michel Corriveau, Radio-Canada.
Bonjour, merci Bruce. C'est une question pour Dr. Russell. Dr. Russell, la question a été posée en partie en anglais tout à l'heure. J'aimerais savoir, là, à cause du variant lambda et du variant epsilon, selon une étude parue dans Science, une 3e dose serait nécessaire. Quand sera-t-il?
Allô, Michel. Alors, ces informations, ça vient juste vraiment devenir public. Alors, moi puis mon équipe, on va faire plus de recherches avec la surveillance qu'on a et les informations qu'on a disponibles à ce moment-ci. Et il faudra qu'on vous revienne.
Autre chose aussi, au Québec, ils viennent d'annoncer que les personnes qui ont 2 doses du vaccin n'ont plus besoin de s'isoler s'ils sont en contact avec un cas de COVID. Est-ce que la même chose pourrait venir au Nouveau-Brunswick?
À ce moment-ci, je dirais non. On a notre plan pour avancer vers la 3e phase, la phase verte. Et à ce moment-ci, on va donner les qualifications de risque à des gens qui sont en contact des cas de COVID. Et ça va être basé sur les risques des contacts étroits et aussi le nombre de vaccins qui ont 0, 1, 2 doses, etc.
Merci, M. Corriveau. Laura Brown, CTV.
Hi there. I'm wondering if you're pleased with any improvements you're seeing among long-term care workers and vaccination rates.
So we've been maintaining, interest in that with knowing where it's been, and we were very pleased with our last update at our last COVID Cabinet Committee meeting. That's probably at the end of June, and we were very pleased with the numbers that in the direction that they were going. I don't have those numbers with me today, Laura, but we can certainly get them for you.
Ms. Brown, do you have a follow-up?
Of course. I'm wondering, Dr. Russell, if you've got a threshold in your mind as we, work towards green and then enter green, hopefully, a case count or what needs to happen for you to take the step backward or you to encourage New Brunswick to take a step back. Is that even in your, is that something that you've been thinking about? Is there a threshold in mind, and what would that be?
Great question, Laura. We are working on a de-escalation plan currently that we're going to be able to make public in August. And during the course of our discussions and planning for that, we definitely have in mind what happens if there are new outbreaks, et cetera, and how to approach that with respect to restrictions and control and containment. So again, with variants of concern and variants of interest evolving, that will come come into play as well. So as of right now, our main concern is getting people vaccinated with their 2 doses. We are seeing great strides across Canada with respect to lower numbers, lower levels of hospitalizations and ICU admissions elsewhere, which means that the importation risk of COVID is much lower, because each traveler has a lower risk of bringing it with them. So we will always keep our eye on hospitalization rates, ICU admissions, et cetera. That's really been our goal throughout the pandemic, is to really prevent our healthcare system from being overwhelmed, and that will continue to be our goal moving forward, even with de-escalation.
Thank you. Bobby Jean McKinnon, CBC.
Yes, thank you. Minister Shephard, what restrictions will there be, if any, on New Brunswickers who choose not to get vaccinated but decide to travel outside of the province or Atlantic region?
At this time, I don't believe we've entertained any restrictions. I think that when we go green, we go green. I think that we've also said that we're going to be monitoring our situation very closely, as Dr. Russell has said. And if public health feels that they need to offer us any advice, if there are situations that happen, then they certainly know that we're open to that. But right now, when we go green, we go green.
Ms. McKinnon, do you have a second question?
Yes, I do. Thank you. Dr. Russell, will testing centers stay up after we reach the green phase? And what will happen if someone tests positive, if they're vaccinated or unvaccinated?
So again, as we move closer to having a higher proportion of our population vaccinated, and as we see the numbers elsewhere in the country continuing to decrease, the risks will be internationally in terms of the global situation. So international travel will probably be the biggest risk moving forward for the country, but also for the province. And with respect to testing, that's going to evolve as well. As Minister Shephard mentioned, right now we're very happy with our testing numbers. We have to have a threshold that we are able to reach to be able to be confident in our numbers. Certainly, again, with that goal in mind of keeping our hospital system safe from becoming overwhelmed. So as we move forward, the testing, obviously PCR tests, regardless of how many doses of vaccine you've had, will show that you're positive for COVID if you're positive for COVID. So PCR tests for sure will continue to be the gold standard, there's no question. So whatever other testing capacity is in place with respect to workplace testing, with point of care testing, which are screening tests only, they do give a certain amount of information, but obviously following up with a PCR test for those who test positive is really important also.
Thank you, Ms. McKinnon. Ladies and gentlemen, that concludes today's update. Merci beaucoup. Voilà la fin de notre mise à jour. Merci beaucoup. Thank you.